Nurse Aide Test Prep HMH. Question 1. When weighing a client, the nurse aide should: Option A, weigh the client at different times each day. Option B, weigh the client at the same time each day. Option C, weigh the client after meals. Option D, weigh the client before toileting. The correct answer is option B, weigh the client at the same time each day. Weighing at the same time each day, example before breakfast, provides consistent, accurate monitoring. Different times, after meals, or before toileting can cause variations. Question 2. When removing PPE, which item should be removed first? Option A, gloves. Option B, gown. Option C, mask. Option D, goggles. The correct answer is option A, gloves. Gloves are the most contaminated item and should be removed first to avoid contaminating other items. The correct sequence is gloves, goggles/face shield, gown, mask. Question 3. When communicating with a client with dementia, the nurse aide should: Option A, use complex medical terms. Option B, use simple, one-step directions. Option C, speak loudly. Option D, ask open-ended questions. The correct answer is option B, use simple, one-step directions. Simple, one-step directions, example, please sit down, are most effective. Complex terms, open-ended questions, and loud tones are overwhelming and may cause agitation. Question 4. When documenting client care, the nurse aide should: Option A, use vague descriptions. Option B, be objective, accurate, and use only abbreviations that are approved. Option C, include opinions about the client. Option D, write in pencil so errors can be erased. The correct answer is option B, be objective, accurate, and use only abbreviations that are approved. Documentation should be objective, accurate, and use only approved abbreviations. Opinions are not appropriate. Pencil should not be used. Documentation should be in ink. Question 5. When assisting with meals, the nurse aide should: Option A, place the food tray on the bed. Option B, place the food tray within easy reach on the overbed table. Option C, feed the client immediately. Option D, leave the tray for the client to manage. The correct answer is option B, place the food tray within easy reach on the overbed table. The tray should be within easy reach so the client can self-feed if possible, promoting independence. Placing on the bed is unsafe and unsanitary. Feeding immediately may be unnecessary if the client can self-feed. Question 6. When feeding a client who has difficulty swallowing, the nurse aide should: Option A, feed them quickly to minimize aspiration risk. Option B, place food on the affected side of the mouth. Option C, place food on the stronger side of the mouth. Option D, use only liquids. The correct answer is option C, place food on the stronger side of the mouth. Place food on the stronger or unaffected side to help the client control and swallow. Feeding quickly increases aspiration risk. Placing food on the affected side can cause choking. Only liquids ignores the ordered diet consistency. Question 7. When measuring blood pressure, the nurse aide should place the stethoscope over which artery? Option A, radial artery. Option B, brachial artery. Option C, carotid artery. Option D, femoral artery. The correct answer is option B, brachial artery. The brachial artery, located in the antecubital fossa, inner elbow, is the site for auscultating Korokov sounds. The radial artery is used for pulse counts. The carotid and femoral arteries are not used for routine blood pressure. Question 8. What factor is not known to affect vital signs? Option A, pain. Option B, age. Option C, hair color. Option D, exercise. The correct answer is option C, hair color. Pain, age, and exercise all affect vital signs. Pain and exercise increase heart rate, respiratory rate, and blood pressure. Age affects normal ranges. Hair color has no physiological effect on vital signs. Question 9. A client with dementia is attempting to leave the facility. The nurse aide should: Option A, allow the client to leave. Option B, redirect the client to a safe activity. Option C, physically restrain the client. Option D, call security to escort the client out. The correct answer is option B. Redirect the client to a safe activity. Redirecting to a safe activity is the most appropriate intervention. The client may be looking for something familiar. Restraints require an order and are a last resort. Allowing them to leave is unsafe. Question 10. When a nurse aide is floating to a different unit, they should: Option A, refuse to float to an unfamiliar unit. Option B, accept the assignment but only do familiar tasks. Option C, accept the assignment and ask for orientation to the unit. Option D, accept the assignment and perform all tasks independently. The correct answer is option C. Accept the assignment and ask for orientation to the unit. Floating is normal, but the aide should request orientation to the new unit. Refusing may be insubordination. Doing only familiar tasks may not meet client needs. Question 11. Which is a violation of HIPAA? Option A, discussing client care with the client's family who is present. Option B, discussing client information in the elevator with another aide. Option C, documenting care in the client's chart. Option D, reporting client information to the nurse. The correct answer is option B. Discussing client information in the elevator with another aide. Discussing client information in public areas, elevators, cafeterias, hallways, violates HIPAA because conversations can be overheard. Discussing with family present, documenting, and reporting to the nurse are HIPAA compliant. Question 12. Which method of temperature measurement is considered most accurate? Option A, oral. Option B, axillary. Option C, tympanic. Option D, rectal. The correct answer is option D, rectal. Rectal temperatures most closely reflect core body temperature and are considered the gold standard. Oral temperatures are affected by eating and drinking. Axillary temperatures are least accurate. Tympanic readings can be affected by earwax and positioning. Question 13. What is the correct way to transfer a client from bed to chair? Option A, pull the client by their arms. Option B, use a transfer belt and proper body mechanics. Option C, lift the client under the armpits. Option D, have the client stand without assistance. The correct answer is option B. Use a transfer belt and proper body mechanics. A transfer, gait, belt and proper body mechanics protect both client and aide from injury. Pulling by arms can injure shoulders. Lifting under armpits can cause bruising. Standing without assistance is unsafe. Question 14. A client has had a stroke and has left-sided weakness. The nurse aide should: Option A, place items on the left side to encourage use. Option B, place items on the right side where the client can reach them. Option C, ignore the weakness. Option D, restrain the left arm. The correct answer is option B. Place items on the right side where the client can reach them. Place items within reach on the stronger side to promote independence. Encouraging use of the weaker side is appropriate but should not be forced. Restraining is not appropriate. Question 15. A client is grieving the loss of their spouse. The nurse aide should: Option A, tell them to move on and focus on their health. Option B, listen and acknowledge their loss. Option C, avoid mentioning the spouse to prevent sadness. Option D, suggest they should be grateful for the time they had. The correct answer is option B. Listen and acknowledge their loss. Listening and acknowledging the loss validates the client's grief. Telling them to move on or that they should be grateful dismisses their feelings. Avoiding the topic leaves them isolated. Question 16. When applying gloves, the nurse aide should: Option A, wear gloves that fit loosely. Option B, pull gloves over the cuffs of the gown. Option C, wear gloves only for blood exposure. Option D, reuse gloves to save supplies. The correct answer is option B. Pull gloves over the cuffs of the gown. Pulling gloves over gown cuffs creates a barrier preventing wrist and arm contamination. Loose-fitting gloves increase the risk of tears. Reusing gloves is never acceptable. Question 17. A client with dementia is eating slowly and forgets to chew. The nurse aide should: Option A, feed the client quickly. Option B, provide verbal cues to chew and swallow. Option C, puree all food. Option D, remove the food after 15 minutes. The correct answer is option B. Provide verbal cues to chew and swallow. Verbal cues, example, chew your food, help the client eat safely. Rushing increases choking risk. Pureeing may be necessary for some but not all. Removing food after a short time may result in inadequate nutrition. Question 18. A client with mental health issues is refusing medication. The nurse aide should: Option A, force the client to take the medication. Option B, report the refusal to the nurse. Option C, hide the medication in food. Option D, tell the client they will get worse. The correct answer is option B. Report the refusal to the nurse. Medication refusal should be reported to the nurse. Forcing, A, or hiding medication, C, is unethical and illegal. Threatening, D, is not therapeutic. Question 19. A client tells the nurse aide that they want to harm themselves. The aide should: Option A, keep the information confidential. Option B, tell the client that they are being silly. Option C, report it to the nurse immediately. Option D, promise the client that everything will be fine. The correct answer is option C. Report it to the nurse immediately. Statements of self-harm are mandatory reporting. The nurse aide has a legal and ethical duty to report this immediately. Confidentiality does not apply when there is a risk of harm. Question 20. Restorative care focuses on: Option A, curing the disease. Option B, maintaining and improving function. Option C, providing end-of-life care. Option D, replacing the client's abilities. The correct answer is option B. Maintaining and improving function. Restorative care aims to maintain and improve the client's functional abilities, promoting independence and quality of life. It is not focused on curing disease or replacing abilities. Question 21. Which of the following can cause an inaccurate pulse oximetry reading? Option A, nail polish. Option B, client holding their breath. Option C, client sleeping. Option D, client sitting up. The correct answer is option A, nail polish. Nail polish, artificial nails, and dark pigmentation can interfere with pulse oximetry light transmission, causing inaccurate readings. While breath holding and sleeping can affect readings, they don't cause device inaccuracy. Sitting up is a normal position that does not affect accuracy. Question 22. The family of a dying client is upset. The nurse aide should: Option A, ask the family to leave. Option B, offer support and a private place to talk. Option C, ignore the family. Option D, tell the family everything will be fine. The correct answer is option B, offer support and a private place to talk. Family members need support too. Offering a listening ear and a private place shows compassion. Asking them to leave or ignoring them is insensitive. False reassurance is not helpful. Question 23. When assisting a client with a bath, the nurse aide should: Option A, bathe the client from cleanest to dirtiest areas. Option B, bathe from the feet up. Option C, wash the perineal area first. Option D, use one washcloth for the entire body. The correct answer is option A, bathe the client from cleanest to dirtiest areas. Bathing from cleanest to dirtiest, face first, then upper body, abdomen, arms, legs, and perineal area last, prevents spreading microorganisms. Using one washcloth for the entire body is unsanitary. Question 24. The nurse aide enters a client's room and finds the client on the floor. The aide should: Option A, pick up the client immediately. Option B, assess the client, call for help, and do not move the client. Option C, leave the room to get the nurse. Option D, document the fall and call the family. The correct answer is option B, assess the client, call for help, and do not move the client. The nurse aide should assess the client, call for help, and keep the client still to avoid worsening injury, possible fractures or spinal injury. Moving without assessment could cause harm. Question 25. The chain of infection includes Option A, pathogen, host, transmission route. Option B, air, water, food. Option C, bacteria, viruses, fungi. Option D, skin, blood, mucous membranes. The correct answer is option A, pathogen, host, transmission route. The chain of infection consists of infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. Understanding the chain helps identify how to break transmission. Example, hand hygiene breaks the mode of transmission.